National Non-Smoking Week is a time to reflect on how far we've come in reducing tobacco use and how much further we still need to go. While smoking rates have declined significantly over the past few decades, tobacco continues to be the leading cause of preventable illness and death in Canada. Each year, thousands of lives are cut short by diseases we know how to prevent. It's not a question of whether we know if smoking is harmful. It's whether we are willing to take bold steps to protect future generations from ever becoming addicted in the first place. That step is smoke-free generations. The smoke-free generation approach is simple and powerful. It gradually phases out the sales of commercial tobacco products to people born after a certain year. It does not criminalize smoking, and it does not target current smokers. Instead, it recognizes a fundamental truth. If young people never start smoking, the tobacco epidemic will finally come to an end. This approach is already gaining momentum elsewhere. Several jurisdictions have introduced or committed to smoke-free generation style policies. Recognizing that traditional tobacco control measures, while effective, are no longer enough. Tobacco companies continue to adapt their marketing strategies, particularly toward youth and young adults, using flavored products, slick designs, and increasingly addictive nicotine formulations. In Nova Scotia, Prince Edward Island, and across Canada, we see the consequences of tobacco use every day. Smoking remains the biggest cause of lung cancer, chronic obstructive pulmonary disease, COPD, heart disease, and stroke. It places enormous strain on our healthcare system and disproportionately affects people facing social and economic inequities. Many people who smoke want to quit, but nicotine addiction is powerful, and the industry that profits from it depends on recruiting new users to survive. A smoke-free generation policy is a game changer. By ensuring that tobacco is never legally sold to future generations, we send a clear and consistent message. These products only serve to harm, are highly addictive, and do not promote a healthy society. At the same time, such a policy must be paired with strong, well-funded cessation supports, including free or low-cost nicotine replacement therapy, counseling, and community-based programs, so that people who currently smoke are supported, not stigmatized. National Non-Smoking Week is also an opportunity to reframe the conversation around choice. Young people do not choose addiction. Most smokers start before they fully understand the long-term consequences, often under the influence of aggressive marketing and peer pressure. A smoke-free generation is not about limiting freedom. It is about protecting young people from a lifetime of dependence on a product that, when used exactly as intended, kills. We have done hard things before to reduce tobacco use. Smoke-free indoor spaces, flavor restrictions, graphic warning labels, and advertising restrictions were once controversial. Today they are widely accepted and credited with saving lives. A smoke-free generation is the logical next step in that same tradition of evidence-based leadership. This National Non-Smoking Week, we have a choice. We can continue managing the harms of tobacco use year after year, or we can commit to ending the cycle for good. A smoke-free generation is a practical, achievable policy choice that would protect health, reduce healthcare costs, and spare countless families the heartbreak of losing a loved one to a preventable disease. The generation that never starts smoking could be the generation that finally ends the deadly tobacco legacy. The only question is whether we are willing to act now to make that future possible. To show your support of smoke-free generation, we are asking people to sign the petition on our website at www.lungNSPEI.ca.